Hi, I'm Denise from Smith Physical Therapy and Running Academy, and today we're going to talk about the IT band and why runners have so many issues with their IT band. Let's first talk about the anatomy of the IT band because I think that'll help you understand why runners have the issues that they have with their IT band.
You'll notice in this picture, the IT band is that band that runs along the outside or lateral aspect of the thigh. It starts just above the hip and then inserts just below the knee. It's more connective tissue, and that plays into how it functions.
And now let's talk a little bit about the job of the IT band. It sits on the outside or the lateral aspect of your thigh, and it acts as a stabilizer to the knee. It helps in things like bringing your leg out or turning your leg out to the side. It helps, or bringing your leg back even. So it assists in some of that, but its role really is more from a stability role. And what happens with runners is that we all love to take really big strides, and that's called overstriding. So overstriding is made up of two components. One is when that foot lands way too far ahead of your body. And the other part of that is when your leg is lagging too far behind you. And so what it looks like is this.
You'll notice with our runner here that when he lands ahead of his body weight, which is represented by the yellow line. You can also see in this back leg, his trail leg or recovery leg, how far behind that it is from him. So what happens is when people land with their foot ahead of them, there is a tendency to roll the foot from the inside to the outside or vice versa. And the same with the back leg, because it takes so long to pull underneath them, there is that tendency or the possibility of the foot having time to whip in or out.
And so what happens when you overstride, as you can see, and that foot lands ahead of your body weight, you may have a tendency to have the leg go side to side. And the IT band's job is to prevent that excessive rotation to happen, so it'll start pulling your leg back as a way to stabilize it. And the same happens when your foot is lagging too far behind you. Sometimes it will have a tendency for your foot to whip in or out. And one of the telltale signs of this is a lot of runners will end up kicking the inside of their lower leg. So you may see mud stains on the inside of your leg, or you may notice, like, why do I keep kicking myself? Well, that's a function of you doing excessive rotation from side to side. And we will have runners that come in complaining about their IT band, and I'll say, do you notice mud stains that you're kicking the inside of your lower leg? And they're always like, yes. And that's exactly why, is there's this rotational movement that happens, and the IT band's job is to keep that rotation from happening. And so patients or runners will complain of pain to the bottom of the IT band, kind of on the outside of the knee that aches. And what the common if you Google IT band syndrome, what you'll see is things like roll it out or stretch it out. The problem with that is that the IT band doesn't have a blood supply. So there are things like tendons and ligaments in our body that do have a blood supply. But the IT band is technically considered an aponeurosis. Now, besides that being a super fun word to say, it means nothing to you guys. But what it does mean is that because it doesn't have a blood supply, it doesn't heal the same way that a ligament or a tendon does. So there's no point in rolling it out. It just hurts. And I'm pretty sure any of you that have ever rolled out your IT band are going to agree with me that it just hurts. So the best example I can give is the example of a tent.
You'll notice in this video from Canopy Outdoors that to make the tent taut, they're pulling on structures that attach to the tent, not the tent itself.
So if we want to make changes to your IT band or the tent, we need to stretch out the tissues that actually have some give. So stretching out things like your quad or your hamstring, some of those tissues that attach nearby to the IT band are really important.
So let's bring back the picture of our IT band, and you'll notice that the IT band lays on top of the quad. So stretching out the quad is one of the best ways to help reduce tension that's pulling on the IT band. Other surrounding structures are things like your hip muscles and your hamstring. Those are also very important to target to help reduce tension that happens to the IT band.
So my best advice on how to fix your IT band is to fix your running. Yes, good running shoes are really important, and we're very lucky here in Crystal Lake to have a shoe store like we do. It's called the Running Depot here in Crystal Lake, and they're amazing, and they are shoe fitting experts. The issue is, though, is that a shoe isn't going to fix the rotation that's happening because you're overstriding. And that rotation is what's causing the IT band to become angry. So let's work on your technique. Let's fix your tendency to overstride through drills, strengthening exercises, and really learn the technique of running and that skill that has to develop. And then we can finally get your IT band issues to go away. So stay tuned. We are going to have another video that shows all the strengthening exercises and the stretches and the mobility work that we recommend to help address the issues at your hip, at your knee that could be causing your IT band issues. Now, this is why we love the human body, but even things like low back issues and ankle issues can cause IT band issues. So it's not a quick fix, unfortunately, but that's why I have a job. So talk to your local PT, figure out with them what is going on. Why is the whole entire system not working that the IT band is irritated? Very rarely is there a problem just at the IT band. It's usually something else that drives the problem, and the way to fix these things is to find the problem and fix the problem, not just treat the symptoms. So hope you learned something today. Comment, let us know if you have any other thoughts on this, or message us if you have any other questions on some treatment options for you. Good luck.